Hey everyone, it's Dr. Ziv Simon here, and today I'm excited to share a conservative approach to treating a perio defect in the aesthetic zone. Now, in full disclosure, this isn't your typical case. It's unique. It comes with its own challenges because this patient was in the midst of ortho when an abscess developed on the palatal aspect of a central incisor, and it wrapped around to the buccal. So this is a tricky situation because these types of defects don't typically respond well to regeneration, surgically and non-surgically. But here's the twist. We treated it non-surgically, and in this photo you can see the tip of the curette piercing through the buccal tissue. Now, was this an oops moment or was it expected? You tell me. I'll dive into this case, into the details of this case in just a moment. So I hope this case inspires you. It's not your everyday scenario, even in my own practice, but it beautifully demonstrates the regenerative potential the body has when you give it the right conditions to heal. And it's the opportunity in perio treatment that I'm excited to share with you. Sometimes thinking outside the box and exploring conservative options can lead to remarkable outcomes like in this case. If you have any questions about this video, or if it sparks ideas or concerns, or you just have questions about perio, feel free to email me back. Share some cases, some challenges that you have in treating periodontal conditions. I hope you enjoyed this video. I hope you benefit from it. Looking forward to seeing you in the next video.
So aesthetic zone cases, be very cautious. Diagnose them early, communicate early. For example, this patient came in with a relatively high smile line. He was in a type of orthodontic retainer or maybe a clear aligner. And he told me that every time he put his aligner in, the tooth would jump forward. And when he took it out, it actually regressed. And he did this over a few months. So what happens? The tooth is subjected to wiggling forces, back and forth, back and forth. So the first thing that we do, we eliminate the trauma. So we stop this orthodontic treatment, and there's an abscess on the palatal aspect. The tooth was completely vital. Your best bet is not an implant. Once you extract the central incisor with interproximal bone loss, you have a huge shrinkage of the bone and tissue, and there's not going to be any papilla, and very hard to place an implant. The diagnosis, first of all, it's localized periodontitis, stage 3, grading B. So what I try to do here, I try to scale in root plane. If you heard about the younger goods curette, when it's sharp, you can follow the contours of the root. It's my go-to curette. Make sure that you have one of those and that your hygienists are using it. Probably spend about half an hour scaling and root planing one tooth. Irrigating with saline, irrigating with Peridex. And as I'm walking my curette along the root surface, my curette started peeking through the fistula on the buccal. Okay, I'm not very proud of it, but this is the path of infection. This is where the infection was draining. What's my goal? To keep this structure untouched. Once you reflect the papilla, it's a big gamble and you usually lose. It's not coming back. Scaling and root planing, it's worth a try. Saline irrigation and Peridex irrigation, a couple of doses of Arrestin inside. Okay, use all the ammunition, and that defect actually resolved. A little bit of recession on the buccal, and there was no bone grafting done. Okay, so we have interproximal bone growth from scaling and root planing. So we stop the trauma, remove the calculus, the etiologic factor, freshen up the root surfaces, and then we have not just attachment, but also bone growth. Now I have to say one thing. This is not a typical case. Okay, I could show you and I'll tell you maybe, every case is like that. This is not a typical case, but it shows how powerful the human body is and how powerful the regenerative potential is if we give it a chance. So I didn't do anything special, didn't require any special skills. I was like a glorified hygienist here.